Well, hi everyone, and welcome back to That OA Thing, where we discuss the latest issues from across the Ombudsman landscape. I'm Donal Galligan, Chief Executive of the Ombudsman Association, and today's special episode, marking Mental Health Awareness Week, I'm delighted to be joined by Rebecca Hilsenrath, Chief Executive at the Parliamentary and Health Service Ombudsman. Welcome, Rebecca.
Hi, Donal. Good to be here.
Yeah, really nice to have you on. Should we start with the types of mental health related complaints that the Parliamentary and Health Service Ombudsman receives? Could you give our listeners an overview of what you've been seeing and whether there are any themes or patterns that stand out?
Sure. And as you know, Donal, we have two jurisdictions about the NHS specifically and then about public services generally. And for all NHS complaints, I think we see a very wide range of issues, and mental health is a part of that. And of course, every case is unique and every case is about a human being and the service that they've received. But there are also themes that we see that recur. Sadly, communication is always there. It's so common to see that just hasn't gone right. And one part of that is how often systems just fail to manage in terms of the responsibility to involve not just patients, but also their families and carers in decision making at various different points in their care journeys. It's about essentially failure to provide patient-centred care. And that's particularly important when people who are living with a severe mental illness might be less able to advocate for themselves. They really need the system to reach out to ensure that the care plan is informed by family, but by carers. We know that there are particular pressures in the system, and I think what we see is that it's those touchdown points, the handover points between different parts of mental health care, transition and handover, so sort of between the acute and the community piece. Also, of course, when mental health services interact with other specialisms and physical health teams, and how well is that interaction and those relationships and communication happening, even between private and public care. It's always a vulnerable place. And in fact, you'll know that we put cases investigating complaints into the NHS, but the local government social care ombudsman looks at social care, and we have a joint working team with LGSEO specifically to look at complaints where you're looking at NHS and local authority care working together. How does that join up piece work? Sometimes that's particularly about the follow-up for people who've been discharged from various sections under the Mental Health Act, and we're looking at, what happens after that with improved mental health professionals or social workers.
It's really challenging as you set out there. It's the variety as well, and that point you raise about someone potentially having to go to two different organisations as well. So that complexity that people have. I think probably one of the big barriers to getting support around mental health probably is still stigma. I know it's improved in recent years, but you can still have that stigma both at an individual level and sometimes within systems. What kinds of barriers do complainants tell you they're facing when trying to raise mental health concerns?
Such an important point. And I think we talk about re-traumatization, or not a great word, but what happens when you've been let down by the system initially, and then you get let down again because the complaint handling doesn't work. I think it's so important that that complaint system works precisely because of the stigma, and precisely because the people who do come to complain, there's already been something that happened in the past. When the complaint system doesn't work, that's kind of what we call compound harm for somebody who's kind of going through it twice. We published a report, you may remember, back in 2023 called Broken Trust. That was specifically looking at avoidable death cases, but we identified 6 recurrent themes when complaint handling goes wrong: failure to be honest when things go wrong, lack of support given to people who are navigating systems that are quite often quite complex, poor quality investigations, failure to respond to complainants in a way that's timely and compassionate, apologies that just are inadequate and sincere, and unsatisfactory learning responses. We want organisations to look at complaints as a source of learning, and that sadly doesn't always happen. So it's about the process going on too long, and this is sort of what we're hearing from people, particularly in the mental health space. And it's a very confusing landscape because, particularly I think, for mental health patients, there are too many different jurisdictions and different bodies, whether it's the CQC, the Care Quality Commission, local government social care ombudsman, us, the Mental Health Act, tribunal. Sometimes you need to be a professional to understand who's the right body to go to. And that's a big challenge to navigate. But there's also some internal barriers that we need to understand, because while they're experienced by the individuals, of course, they result from the environment. So there's often a fear of speaking up when things go wrong. Often that can be about being worried that there could be repercussions to your ongoing care if you complain. And I think particularly in the mental health space, you might be complaining about a place of care that's also your home. And for somebody who's being cared for in an inpatient mental health service, that's quite frightening if you think about repercussions in terms of a complaint. But sadly, also, a lot of people feel that their complaint isn't actually going to lead to change. We know that's a key reason why people don't complain. And we know this because we've carried out research and asked people. And of course, what we need to do to address that is make sure that we are effective. And when we can achieve redress for somebody through the complaint system, we publicise that and we talk about it to make sure that we're encouraging other people.
Yeah, I think you're touching on there. Just it's difficult enough, isn't it, when these issues come up, as you say, the situational issues there, to then have a system that is not patient-centered. You talked about the importance of things being patient-centered and the design around that. If the system isn't, well, that's gonna make things worse, isn't it? And I know we have lots of conversations and informed opinions on how that system could be improved. As you've highlighted, ombudsman schemes have a powerful role in identifying systemic failings and driving change. How do you see PHSO's role in improving how mental health is handled, both at that individual complaint level and more broadly?
Totally, and thanks for recognising it, because I often think I talk to people about what I do, and I think we have two jobs. That's that piece about looking at individual redress and access to justice for people whose complaints have not been addressed, and looking to see how you can improve the service so that you don't get the same problem coming back, which actually is often people's motivation in coming to us. They say they don't want this to happen to somebody else. And sometimes we see this work in terms of individual case reports. Sometimes it's about insight reports where we're seeing thematic issues. And an example of that, last year we published a report on discharge from mental health care. We had a series of case studies relating to the pathway between acute mental health care, emergency care, community services and home care. It was very positively received, and we've had some really good response from NHS England and from the Department for Health and Social Care, who've been undertaking work looking nationally about what good mental health discharge policy looks like. And in fact, our work was cited by the Care Quality Commission as an example of key insight, particularly in relation to their investigations into care system failings in the really tragic case in Nottingham around Valdo Galligan and his discharge, which of course very tragically led to the deaths of 3 people. And I was interviewed for the media on that because of the overlap between that case and some of the work that we've reported on in our insight report. And the key themes from our report were around, again, family carer, patient involvement in discharge planning. Poor record keeping is often something that we see across the piece. And again, poor communication. Poor communication, not just with the patient, but between different professionals, multidisciplinary teams involved in discharge planning. In terms of individual cases, an example we shared actually with the media when we launched this insight report, a young man who'd been experiencing low mood, talked about suicide to his family, had been using drugs as a coping mechanism. He called the police and explained that he was having suicidal thoughts, and they took him to A&E. And the local trust assessed him and discharged him on the same day with a care plan and contact information for self-help support organisations. But the details for that information were out of date, and he tried to reach them, he couldn't get through, and the family had not been involved with the trust and the discharge. And very, very sadly, this young man took his own life. We couldn't help that person, but the trust apologised. They changed the system, including the process that they go through to ensure that contact information is up to date. Probably also worth mentioning that as well as cases and insight reports, it's really important that we engage with the statutory process along with other stakeholders. And we are going to be giving evidence to the Lampard inquiry into Essex mental health care. And you may be aware this is about the deaths of 2,000 mental health inpatients in Essex. We reported on Matthew Leahy, who was 20 years old when he died. The report we came out with in 2020, we found multiple failings, including failure to allocate key worker, to plan care, to engage, to maintain observation, to assess risk, to answer allegations of rape, record keeping, and honesty. I mean, this is a wide spectrum of really poor failings in care. And actually, there's been a case reported this morning on the BBC. I don't know whether you've seen this, but again, very sadly, a teenager who died in inpatient mental health care in Essex. And there, again, there was a failure to observe, a real defensiveness afterwards. There's a paramedic who was interviewed who talked about meeting locked doors and people just saying, I don't know what happened. And that the Lampard inquiry are monitoring the inquest into that really sad case. And also, just before I stop, on a similar note, worth mentioning that we are working to highlight our work on eating disorders to some government work on this. We want the government to do more, and we're going to be giving evidence to the all-party parliamentary group on eating disorders in June. That's based on a report that we published in 2017 called Ignoring the Alarms.
Really, really important issues that you're touching on. Very, very emotional, very challenging as well. The details of these things, and I think one of the things that there's been more conversation about in recent years across the ombudsman landscape is the impact that has, the pressure on people working in complaints handling roles. Hearing those difficult stories, working under high caseloads, often with emotional intensity. How do you think people can better support well-being in their own teams and across the ombudsman community, considering the subject material that they're dealing with?
I'm really glad you asked that question, Donal. And of course, it's so important in terms of ombudsman values and the importance to us of well-being in our teams. And there are a range of things that we put in place that I know other ombudsman services will as well. We have a mental health first aider network. We have a freedom to speak up guardian in line with good practice in the NHS, which allows staff to raise concerns informally. We have peer support. I know you support this kind of across the ombudsman community at all levels, which I benefit from myself at a senior level. But also we have more formal sources of support, such as through our employee assistance program, and the whole way that our teams are structured in terms of managers and support and cluster work is, I think, really valued by caseworkers. We do offer training where that's appropriate, but I think above all, it's about ensuring an open and compassionate culture and that need to practice what we preach.
Yeah, culture is so crucial in every organization and sadly often overlooked, isn't it? We were talking about staff there. Leadership in high pressure public roles comes with its own set of challenges as well. How do you personally navigate the emotional demands of leadership? I guess especially when you're dealing with difficult or sensitive issues like the ones we've been discussing.
So I think I'd start with saying that leadership is a privilege, and I think that needs to be acknowledged. But I always think about, that thing when you get on an airplane and they talk to you about the safety procedures. And it says, in the event of an incident, the oxygen masks descend, and you've got to put your own oxygen mask on before you start helping other people. And I think that's such a sort of vivid metaphor. Empathy, of course, is a key ombudsman value, but you have to direct it to yourself and to other people. I'm going to be very honest and say that I'm prone to depression, including postnatal depression. I've got 4 children. Actually, they're not children; they're adults. But way back, I had postnatal depression 4 times, and I have people in my immediate family with significant mental health challenges. So I do have some knowledge and experience of this. It doesn't mean that I've been in other people's shoes. And I think, as I said earlier, I think there's a risk of saying that all cases are the same and people have very different challenges. But what I do appreciate and I have learned is that we're all human beings and that it is possible, and in fact more than possible, it's important, it's an imperative to feel compassion and humanity towards somebody whose life perspective is simply very different from yours. And to deal with that, I think it's just really important to be grounded in your team. I have always tried to lead teams which are honest and able to share, so that whatever you're dealing with and how ever difficult it is, you don't have to do it on your own. And there is a place to come home to and say, this is what's going on. What do you think? And let's reflect on how we're handling it as an organisation and how I'm doing personally. And I think that's really important.
Yeah, really, really good advice. Look, thank you so much for joining us and for sharing your insights on this important subject. But before we go, as we're marking Mental Health Awareness Week, what's one key takeaway you'd like to leave our listeners with?
Well, first of all, thanks for having me, Donal. It's been great. And as you say, it's such an important topic. I think I'd just say that I'm really struck when I look at our reports that it's often the repeat failings that leap off the page. So I would say put the patient at the centre of the conversation, put their family and their loved ones in the conversation with them. And when things go wrong, we know what the basics are. So get them right, be honest, be accountable, be empathetic, and be ready to learn.
I think that's a great point to leave it on. To our listeners, as always, if anything we've discussed today resonates with you, we encourage you to explore the support available. We'll include links to resources and organisations in the podcast description. Mental Health Awareness Week is a time to reflect, but also to act, as we've been talking about, whether it's looking after your own well-being, supporting a colleague, or working to improve services for others. So don't forget, you can stay connected with us on LinkedIn, X, Instagram, and Threads under Ombudsman Association. Do subscribe to That OA Thing on Spotify or YouTube so you don't miss future episodes. In the meantime, please take care of yourselves and hopefully you'll join us again next time.